Hi there, this is Mitch from Great Southern Health, coming to you today from our clinic here in Albany, bringing you some tips on how you're able to help yourself at home or when you're out and about. So the first point I'm going to let you know about today is one that is very, very common that we use in the clinic. It's really, really good for motion sickness, so travel sickness, if you're out on a boat, so seasickness, any sort of motion sickness traveling in the car, but it's a really good point for morning sickness as well, so we tend to use it a lot in pregnancy. So the beauty about acupuncture is the measurements on your body are unique to your specific size and shape. So the fingers that you're using, the size of your thumb, the size of your hand, it's all got to do with the anatomy of your body, so you can find it relatively easily and it's going to match the size of your body. So the first point that we're going to do today is called pericardium 6, so it's on the pericardium channel. What you're looking to do is find your wrist crease, and you're getting your 3 fingers and you're basically just putting it from the wrist crease back along your arm, and where your index finger is, that's the point that you're looking to get. So you've got 2 tendons that are running down here. You're wanting to get in between the 2 tendons, obviously missing any sort of blood vessels or veins if you can see them, and it's just a matter of putting your thumb or a pen or anything that you're feeling comfortable with, and just applying a little bit of pressure that you feel a sensation, and then maybe just relieving it a little bit, applying a little bit more pressure, and just doing that until whatever you're experiencing subsides and you're starting to feel a little bit better. So it's just a really, really good point if you're feeling a little bit worked up, if you want to unbind the chest, if you want to sort of calm the mind. It's really, really good working on the stomach channel, so that nauseousness that's coming up and sort of aggravating your chest and making you feel a little bit uncomfortable. So you don't want to apply too much pressure that you've got an indentation. So it's just being comfortable with what you feel is adequate, but obviously it needs to be hard enough that you feel a little bit of a sensation. Okay, so that's PC6. The second one is a really, really good one for pain. It's the command point for pain, it's the command point for the head. So neck pain, headache, toothache, jawache, anything to do with the head, it's a really good point. It's on the hand again, so it's really, really easy to find. What you're wanting to do is put your 2 fingers together, or put your thumb in. Where this big muscle gets nice and large, it's right in between where your bones are meeting. And again, you're getting your thumb into that point and just applying a little bit of pressure. You might have to move it around just a little bit to kind of find the exact point, because everyone's a little bit different. But again, it's going to be just a little bit tender, and it's going to be more sensitive than any other points. Really good point if you've got a headache, a toothache, an earache, any sort of just pain within the head, but pain generally within the body is really good. So if you're sitting down watching telly, if you're on the bus, you've got a headache, you haven't got access to acupuncture needles, get your thumb or get a pen lid in there and just give it a good little bit of a massage. The next point we're going to look at is on the back of the head. It's a really, really good point for headaches, so as well as this one with pain, but because it's on the head, it's going to help directly. So what we're going to do, I'm going to turn around. You're trying to get where your skull goes down into the little soft squidgy bit. It's these 2 little bits here. So it's very easy to find. You can just sort of roll your thumbs down over the base of the skull and applying a little bit of pressure. Not too much, but enough that it feels like it's a little bit of a relief. Letting go again. You can put 1 thumb in, you can move your head around, trying to just get a little bit of pressure to kind of just relieve whatever tension or strain or stress that's happening within the muscles or within the channels that are wrapping up and potentially causing that headache. Okay, so there you have it, some points that can help you when you're out and about and you can't get in for an appointment, or you just need a little bit of relief for some pain and nausea. Okay, thanks very much, and we look forward to seeing you again soon.